The amount of medical knowledge that is available in the world actually doubles every 73 days. That means if one of the doctors in a hypothetical situation learns everything that is there on a particular disease, in right after 2.5 months, he'll only end up knowing half of it. And another 2.5 months, only quarter of it. So this is the staggering amount of increase in medical knowledge that is happening in the world. Just to give you a perspective, in a year, there are 2.5 million papers that are being published across journals. So how does a doctor keep up with all this? How do we scale ourselves in a way where we can adopt this medical knowledge that is growing at this staggering pace? So that's where one of the tools that we are going to talk about today comes into picture. Let's move into the video, which is particularly on clinical decision support systems. Clinical decision support systems, or CDSS, or CDS in short, are basically tools that have been specifically designed to help doctors in their clinical decision making. Does that mean doctors are not capable of making their own decisions? That's not the actual picture to be painted here. Let's move on to the video and first understand what actually are clinical decision support systems, how are they useful to doctors, what can be the potential benefits and also potential harms of using CDSS tools, what is the current adoption rate or where does India stand in adopting these tools, and finally, the biggest question in picture, how does a doctor build a very healthy relationship with CDSS and not become overly dependent on such tools? Before we understand what are clinical decision support tools, let's understand what they are not. They are supposed to be different from symptom checkers and clinical knowledge reference tools. Symptom checkers are tools designed to assist patients in understanding their symptoms better and triaging their health condition. These are not meant or not designed to be used by doctors per se. The tools like WebMD, UpToDate, Medscape are all meant as clinical reference or clinical knowledge reference tools, which might help doctors in passive decision support, but are not to be looked upon as clinical decision support tools meant for active decision support. Now, to understand clinical decision support tools, remember this simple framework. CDSS tools are meant to assist you with 5 rights. Right information. What kind of information that you need at the point of care. Right person. Let it be to you what has to be shown. Let it be to the care team, the nurses, the pharmacist, everybody who is in the care team, what information has to be shown to which person. The right format, meaning is it to be shown as an alert? What is the difference between an information that is very critical to be looked upon versus something that can be shown as just for reference? Right channel. Is it part of your workflow? Is it appearing on your screen when you are trying to enter something in your medical record? Is it being pushed towards you after you have completed the case? And finally, it is all about right time. All of this information, even if it meets all of the other rights, if it is not given to you on time, it would not be helpful in right decision making. So on paper, clinical decision support tools look like they can actually solve a lot of problems. But what is the reality? Let's just talk about what does the evidence say on how these tools can be useful or how they can be harmful. If you talk about the benefits, one of the most important or one of the most proven benefits of using CDSS tool comes in medication errors. Close to 55% of controlled studies showed that using CDSS systems can help reduce medication errors. The second space where it is actually helpful, where 20% of the controlled studies show evidence, is it helping in reduction of diagnostic errors, making more accurate differential diagnosis and also concluding on what would be the final diagnosis. The third space where it can be proven to be beneficial is adherence to protocols and standardization of care. Close to 15% of studies have shown that using CDSS tools helps in standardization of care, therefore improving the outcomes of the patient. And when all of these 3 benefits align well, there is obvious cost reduction that happens. Close to 22% of the studies have shown there is obvious decrease in the cost when CDSS tools have been implemented. Finally, not as a standalone, but when also combined with other tools like voice-based dictation systems or workflow integration systems, CDSS tools are also proven to be beneficial in improving the efficiency of the team and the processes alike. Now, what about the harms? One of the most glaring harm or glaring disadvantage with using CDSS systems is something called alert fatigue. The CDS systems is known to throw alerts and information onto the doctor's screen in a continuous fashion, which usually leads to alert fatigue that is experienced by a lot of doctors that use these tools. To tackle this, there is a lot of research going on in understanding how to show the information in a way which is more meaningful and how to actually classify the most important alerts versus the least important alerts. The second disadvantage is the chance of error in diagnosis done by the CDSS system itself. Because a lot of the CDSS systems work on limited if and then rules until now, what happens is there is a chance that it can also be biased towards a certain population, towards a certain kind of conditions, and give false results. There is a lot of research also going on improving the efficiency of these CDSS tools. And the third and one of the most controversial aspects of using CDSS tools is if something happens, who is liable for the decisions? So here is one of the most important caveats that every doctor needs to understand. Does not matter which tool, which equipment, or what modality the doctor would have used to make a clinical decision. In the end, we as doctors are responsible for all the outcomes that follow. So it is important that we remember this while making all of the clinical decisions on any patient. Before we conclude the potential benefits and also harms about CDSS, let's understand what is the future of CDSS tools. With artificial intelligence coming into picture, CDSS tools are going to become more smarter and also become more transparent in terms of its decision-making process. Doctors would also be able to develop their own algorithms, and doctors would also be able to tune the response that comes from a CDSS systems to their liking. Yeah, if those were the statistics in terms of the benefits and harms of CDSS tools, what do the numbers say about adoption of CDSS systems? In developed countries like US and UK, the statistics show that 96 to 97% of hospitals and clinics across US and UK have adopted CDSS systems in one way or the other. While it is less in underdeveloping countries, close to 60 to 70%, India paints a completely different story. Here, the adoption is known to be less than 15%, though there are no strong studies that actually give a right number. The core reason for this might actually be lack of clinical digitization, meaning a lot of the doctors still prefer to use pen and paper to write their prescriptions. With the changing sentiment of doctors and rapidly digitizing clinical practices, these numbers might be different 1 or 2 years down the line. Now, let's talk about what is the doctor's perception on these CDSS tools. When a large survey was conducted on usage of these tools, 80% of the doctors actually felt CDSS tools can be useful before it was given to them. Surprisingly, after it was used by the doctors, this number was cut by half. Only 40% of the doctors felt they're actually useful in day-to-day scenarios. The reasons here are something that are to be noted. Though these doctors were really satisfied with the decisions or the information that was being given by these tools, they were dissatisfied with the hindrance it was creating in their daily workflow. So it's really important for people who are building these tools to work alongside the doctors to get a clear picture of the nuances that are involved in a doctor's workflow and also understand how to seamlessly integrate CDSS tools into them. Now that you have understood what are CDSS tools, how they can be beneficial, what are the potential harms with using them, let's see how you can get started with them. First, you can actually start off with passive clinical decision support using these clinical knowledge reference tools that we have discussed earlier. Search on evidence for a particular disease, understand what does the latest protocol say, and try to implement it in your clinical practice. From there, you can eventually move on to using these clinical decision support systems in real time while you treat the patients. Now, where do you stop? How do you understand what usage is too much? If at all, if you're feeling that you would not be able to make decisions without the usage of these tools, that is your red flag and you must stop using these tools. Find the harmony, find the balance between making better decisions using these tools and not go to an extent where you feel handicapped without usage of these tools. With doubling medical knowledge in every 73 days and increasing medical complexity and also increasing patient demands, doctors also need to evolve each day. Follow Augsidius to stay ahead of the curve.